Dr. Palomeno, thank you so much for joining us today on the show. Good to see you again.
Thanks, Janelle, for having me. This is great. This is a great platform. It was great.
Let's talk about that. Your thoughts first. As an endocrinologist, I know that we've, in a different show, I've spoken to you a few times about Filipinos and diabetes, Filipinos and heart condition, and now it's still a problem. A lot of people are saying that the underlying condition makes COVID really strong, potent when it hits a person.
That is correct. In fact, the studies have shown that 91 to 94% of people that die from COVID have an underlying condition. And those underlying conditions, they can be broken down to about 5, 6, or 7 of them. And this is what they are. They are obesity, diabetes, hypertension, heart disease, cancer, lung disease like asthma, emphysema, COPD, something that you get if you're a smoker, being elderly, being over the age of 65. And surprisingly, the other risk or half risk is being male. Males actually have increased risk of death 2 times more than women. So it's interesting.
Your thoughts on that first. This is the first time I'm hearing that more male than female.
First of all, when we look at the chronic illnesses, it would make sense that when you get any kind of infection and you have an underlying illness, you're going to have a depressed immune system. Of course, if you get a lung disease, you're going to have a harder time. Of course, if you have cancer, people that have cancer have a lower immune system. Older people have a lower immune system just because they're older and they have more illnesses because as they've gotten older, they've accumulated more illnesses. And interestingly, men, we're not really sure yet. That's the verdict is still out as to why that's the case. But interestingly, men have more risks. And we're not sure if it's because men tend to have more risky behavior. They're not as into preventive health. We don't know if it's something more due to lifestyle as opposed to women, or if there's a hormonal issue. They're still trying to figure that out. But that is definitely a risk factor.
Obviously, it's the novel coronavirus, which is new. It's a new virus. We're figuring it out as we go. But I know that hypertension, obesity, diabetes, we've been talking about this all the time, especially with Filipinos. That's the propensity for Filipinos to get those illnesses is very high.
You know, and it's interesting, and I think that it might have something to do with inflammation. One of the reasons why COVID-19 is so deadly is because it causes an increased inflammatory response in the body, almost an exaggerated inflammatory response. The people that really have a problem with it or die from it have an exaggerated inflammatory response once they get the virus. The inflammation in the lungs becomes so severe that that's how they end up passing from it. So I'm wondering if there's these underlying diseases, which we've seen all the time, which also causes all the deaths in general. These people that have diseases have an underlying inflammation. And when you add COVID-19 on top of it, it just makes that inflammatory response worse.
When you say inflammatory as using it in medical terms, what does it mean?
For example, let's say you get a scratch on yourself, or you get a scratch on your skin, you see that it gets inflamed, it gets red on the outside, it gets swollen and painful. That's basically what's going on the inside of your body when you have these diseases. If you have obesity, you have a lot of inflammation, or you have like redness and swelling around your organs. Same thing with diabetes, heart disease. So just think of it, when you get a scratch on the outside of your body, when you have these diseases, it's like that on the inside of your body. Right. That's inflammation.
So now for people that, is it too late for them? Can this be reversed now? How can they take care of themselves if they already have that underlying condition?
The important thing is to get under control, because the studies have shown, actually, that's a really great point. If you take a group of patients that have diabetes and are controlled, and a group of patients that had diabetes that weren't controlled, the studies have shown if those groups get COVID-19, it's the people that aren't controlled that end up going to severity and death.
I want to underscore that fact for our viewers. If you have diabetes, or if you are pre-diabetes, then you can there's still hope, right? You can't be too paranoid, don't panic, because you can still control it. So how do we control it, Gladys? What are your top 3?
First thing we gotta do is we have to eat better. We have to eat better. Less carbs, less processed food, more vegetables, fruits, lean proteins, lean meats, fish. Vegetables, we're talking green leafy vegetables that have low carbohydrates. So like when you look at like lettuce and kale and spinach, those have virtually no carbohydrates in it whatsoever. Broccoli, those are high in fiber, high in nutrients, but virtually no carbohydrates. Some of the things that may be misconstrued as vegetables but are actually carbohydrates are things like corn, squash, peas. Those actually have carb in it. So we're talking more vegetables that are green, leafy, high fiber.
And then your point number 2.
The second thing is exercise and keeping your weight down.
Right.
So, I mean, obesity is a big factor, but if you exercise, not only going to keep your weight down, but you're going to keep your sugars down, you're going to keep your blood pressure down.
It doesn't have to be so elaborate. You don't even need somebody like, you don't need to follow a program. You don't need equipment. You don't need, even running, just always moving, walking, it will help, right?
Okay. Yes, walking around outside, just going outside and walking around your house, walking around your neighborhood, that counts. Any movement will help.
And point number 3.
The other thing is sleeping better. You really should sleep. One thing I have to say about Americans in general and Filipinos also is we work really hard and we don't sleep. And sleeping, if you don't sleep, you're going to lower your immune system. Right. So, especially a lot of the nurses that are working long shifts. I know that you're working long shifts in the hospital because of this. It's really important to sleep. Take care of yourself.
Let's talk about this because I know that before we filmed this interview, or before this interview, we were talking as friends, and you talked about the possibility of maybe this virus has been going around even before we were able to name it as such. Tell us your thoughts on that.
So first of all, if we look at the latest reports, and they're saying now that the first person that they think got COVID-19 in the United States, or the first death, was on February 6th in Washington. This is what the U.S. officials are saying. So that's February 6th that the person died. So that means that she had to contract it. In order for her to have passed away from it, she had to have had it at least several weeks, because it takes 2 weeks for you to get it and to get the symptoms, and then for her to have died from it. So let's go back 3 weeks from February 6th. That means she would have had to contract it mid-February, or the first half of February, right?
Right.
So, of January.
Of January, yes.
So if she got it in mid-January, that means, where would she have gotten it from? So that means maybe it was related to the travel that happened over the holidays. And if you look at the timeline that China's giving us, so a doctor discovered it in China in December, which means in order for him to have looked at the data, it had to have happened a few months before December. So let's say September, October, November, in order for him to have noticed something going on, for him to report it in December. But when he reported it to the Chinese authorities in December, it was not released until the end of January to the rest of the world. So that means during that time of, the holidays in December, this was happening. It was happening, and everybody was traveling during the holidays. And so it makes sense to me that if that was happening and people were traveling, then in January, when this woman got it in Washington, then she contracted it probably right after the holidays, and then she passed away on February 6th. So it's probably been going on a little bit earlier than what we are recognizing.
Which brings me to my experience. I had both children got very sick. For the first one was Lily. She started throwing up, fever. She was coughing, but it was dry. I remember rushing her to the ER around 3 a.m., like 3 in the morning, and they swabbed her for influenza. This was around December, early part of December, maybe first, second week of December, and they couldn't. She tested negative, but they said it was a virus.
And that's really interesting, because I'm getting a lot of those stories, especially from some of the ER doctors that I know, that they were seeing really extreme cases over the holidays, December, January, of like flu-like illness, and a lot of people, and they were testing them for the flu, and the flu tests were coming back negative. Right. Or I got people that were, they thought they had strep, and their strep test came back negative. And so now that the COVID-19 antibody testing is out, it might be worthwhile for some of these patients to just go get it to see if they actually did have it.
Right, exactly.
In my opinion, there's a really gray area. There's a gray area from December through January that we have no idea really when it came to the US shores.
I remember around January, Leo, my 1-year-old, also got sick, but this time his nose was bleeding because of high fever. We had to rush him to the ER. And again, the same thing, there was a virus. And it's so frustrating when you don't know what kind of virus it is. We were just getting these statements from the doctors, from the pediatrician saying, it's a virus, it will pass, you just have to deal with it right now and make him comfortable, make her comfortable. But you know?
I hear so many of these stories, and I've heard them from friends in my family. My mom got sick. Same thing. My children got really sick also. So there is really definitely this gray zone that we're not really sure. So if you had a severe illness around that time and some of your symptoms coincide with that of COVID-19 and the antibody testing is available, why not? I would recommend go ahead and get it to see if you did get it, because if you do have antibodies to it, then you're not going to be so scared now. Because you're like, okay, I already had it, I got antibodies.
As a medical practitioner now, let me ask you, how reliable are these tests now? Because I'm also getting reports that they're not yet 100% reliable.
Yeah, and you're right, they're not. There's a lot of different tests, and it's really kind of confusing. Even I'm confused. I'm not even really sure. Right. But the one I'm looking at really is I'm looking at the antibody test more than anything else, because of course, if people need to know when they go to the hospital if they have it, if they feel sick. But if you're someone that thinks you might already had it, you have to look at the antibodies, because the antibodies are proteins made by the immune system that basically flag viruses and other bacteria. And once your body is exposed to a particular germ, like a virus or bacteria, it creates an antibody against it, and that antibody is on file in the human body, in your body.
Right.
So it's kind of like a memory cell. It's
right.
like a memory protein. So if you got exposed to it and you have the antibodies, then you will know, oh, maybe I had it, maybe I got exposed to it, but I've been exposed to it, and I've got some, resistance.
Immunity, yeah.
That sort of immunity to it. So, I'm not going to be so worried, if I go out in public, because I know that I've been exposed to it already.
But also they're saying now that there's like a second strain. Some people also are reporting, there's some reports that people who have recovered are now getting it again, or it's just...
Well, so this is the thing, is we don't really know how this virus is. We don't really know, because it's brand new. So we don't know what the long-term is. We don't know what the long-term effects are. But it might be something like, for example, chicken pox. You get it, and then it just stays in your system forever, okay? It doesn't really totally go away. And then later on, when you get older, you can get shingles. Shingles is basically chicken pox. It's resurgence of chicken pox. And you can get it when you're immunocompromised, meaning, you're run down, or you're sick with something else, you can get shingles. Mm-hmm. So shingles is basically chicken pox that you had when you were a kid. So we don't know if it's something like that it hides in your body. The other thing, too, is just like the flu, as you know, every year we have to get a...
Right, different strain, yes.
Yeah, there's a new strain that pops up. There's a new mutation. Mm-hmm. The core of the virus is the same, but it changes a little bit, which tricks your immune system. Your immune system has to make a little bit different antibody. Right. So we don't know if it's something like that. Right. So, and it could be, but remember, when we do get a flu shot, the core is similar. We just kind of have to alter it to whatever strain is out for the year. Mm-hmm. So there's a lot of things we don't know. Right. But I think that the key is, to be confident in your immune system. If you do have antibodies, then you can say, hey, I got exposed to it. And I did okay.
And one final thing, it's just because you're, like I said, you're an endocrinologist, you're a doctor, medical worker. When do you think are we going to see the end of this? There are talks now about California opening up for stage 2, maybe relaxing some of the stay-at-home order and restrictions by May 15. Your thoughts on that?
It's interesting, because if you look at each state has its own peak and trough, right? So if you look at the models for California, they said that our peak was around April 26th, and that we should be done with it by the end of May. So that's kind of where they're going with. However, a lot of the U.S. officials are looking to see what happened in Singapore and what's happening in Hong Kong and other parts of Asia where it hit first. So Singapore and in Japan, that's another place. So it hit those places first, and they really locked down. They got it under control, and then when they started relaxing, they got another resurgence, and they had to close again. So I'm thinking that we might open up over the summer, and then it might close again in the fall. Mm-hmm. So there might be this open, shut kind of a thing. Or it might be kind of a halfway thing, not fully 100% open, because we're kind of looking to see what Asia is doing, and that's what Asia is doing. And I think it might be like that. The reason why is if you open all the way 100% and then everybody gets sick and they flood the hospital, they're not able to handle it. So if they open and close and open and close and do it kind of slowly, it won't overwhelm the healthcare system until we have a reliable vaccine, until we have reliable medications that we know can abate, the spread of this virus and also decrease the severity of it.
So in the meantime, we can't control that. We can't control the virus. What we can control is ourselves, our eating habits, our sleeping habits, and our lifestyle. So exercise, that's the only thing we can do, is try to keep ourselves protected by staying healthy.
Yes, absolutely.
All right. Thank you so much, and more power to you.
Okay, bye-bye.